Welcome to The Lens, hosted by Catalysis, where we get a glimpse inside healthcare organizations that are transforming to a culture of improvement to deliver continually higher value outcomes for patients, staff, and communities. Visit createvalue.org/The Lens for more information about Catalysis.
Welcome back to The Lens. I'm your host, Peter Mariahazi. Today, I have the pleasure to be joined by Kellie Olmstead, the Vice President and Chief Transformation Officer at Nemours Children's Hospital in the Delaware Valley, to discuss how they utilized multiple aspects of the management system in defining as well as deploying their strategic plan. Before we start our discussion, we'd like to introduce our new organizational subscription to the Catalysis Academy. This is a great opportunity for your organization to establish common ground in learning so that you can build a community of problem solvers. Check out at createvalue.org/academy to learn more. Kellie, thank you for joining us today.
Thank you for having me.
To kick us off, please tell our listeners a bit about yourself and Nemours.
Sure. So Nemours Children's Health is among the largest integrated multi-state, multi-hospital, multi-site children's health system. We employ about 900 subspecialist physicians, and we do about 1.8 million patient encounters a year. We operate in 5 states, 2 freestanding children's hospitals, one in Delaware and one in Central Florida, and we've got over 75 locations. We do pediatric clinical care, research, education, advocacy, and prevention programs. I serve as the Chief Transformation Officer for the enterprise, and my background before Nemours was in fixture manufacturing, and that's where I learned lean on the job in an operational role. I joined Nemours about 14 years ago as they were just beginning their lean journey. And over the past 2 years, my roles expanded as we started with the strategic plan, and I was fortunate to serve as the chair of the planning committee. With my CI background, it really allowed us to bring all of the pieces and parts together. And so that was the exciting part. I've learned a lot over the past 2 years, but it also let us connect a lot of dots.
That is quite a transition from fixture manufacturing to healthcare. So, you talked about being, the driver, if you will, the lead on the strategic plan. Walk us through the management system in developing the strategic plan. What did Nemours do?
Yeah, it's a really unique approach, I think. So we partnered with DHG Healthcare, and they have a pretty innovative approach in how they come at strategic planning. But they really, we took our leadership direction from Dr. Moss and our executive cabinet around engaging all associates. And so, for us, it really is about mindset and then the management system and methods. And the mindset led us to engaging everyone that wanted an opportunity. And so we've got about 8,000 associates, and over 4,000 of them engaged in some way. And so it was just, the approach was really, I think, exciting and engaging and impactful. And now we've got 4,000 people that feel like they own part of this plan.
Wow, and obviously that's one of the principles is make it systemic, make it cultural, make it so that everybody feels like they're a problem solver, right? So how did you take and incorporate elements of the management system in that?
So really, when you think about the approach on the strategic plan itself, we took the mindset of engaging associates, and we worked our way through what we would think of as, improvement events or Kaizen events. They were engaging events that, would lean on data and interviews, as well as our current state, and really think about how we could do things fundamentally different, breakthrough thinking. And so that really is the connection. We developed 5 strategic pillars and then 3 foundational imperatives. And we engaged people in work sessions, if you will, big in-person pre-COVID, sessions where you had people thinking in really an unlimited way. And we worked our way through that over time, right? And got to really detail and actionable, measurable, substantive plans for the strategy that then will be deployed, right? So we've got the infrastructure to deploy that through our management system. But we really worked our way through the strategic plan with these in-person collaborative events.
Wow. So then you mentioned the management system. So talk us how you utilized aspects and implemented aspects in that strategy deployment of the management system itself.
Yeah, our management system, as we think about it broadly, has been in place for well over a decade at this point, right? We run 800 huddles a day across this organization. It's a pretty robust management system in general. We've got a good process for goal deployment, but frankly, it was never really anchored to a robust strategy. And so that's really how all of the pieces came together, is that by developing this overarching, really innovative strategy with our associates, now we're able to deploy really effectively through the management system. And now we've got the bi-directional flow of information. We've got, goals that cascade down to an individual level in a much more meaningful way. And then we've got results and information that go back up, through our leadership ranks.
So I imagine, as you say, at an individual level, then they can see how they connect to the strategies and the desires of the organization as a whole and how they contribute to that, don't they?
Absolutely. Yeah. All the pieces came together. I mean, that was really, up until this strategic plan, we had many of the puzzle pieces available. They just hadn't come together. And over the past 2 years, we're slowly getting them together. And right now we're really starting to fire on all cylinders with it.
So it sounds like it wove together nicely, but as we all know, there are challenges, right? So talk to us a little bit about some of the challenges you faced along the way.
Yeah, I mean, there's always challenges, right? But I think for us, the timing was certainly not ideal. We were scheduled to finish in April of 2020. And we all know that in March, things, changed dramatically for us. And so it really extended the timeline. I think that tested us in many ways. It tested our commitment to having associates engaged. Would have been much easier at that point to say, let's wrap this up and sort of fast track it through a senior leadership exercise. We opted to stay the course and really pivot to Zoom type events where we brought 50 and 60 people together. We brought clinical and non-clinical people together to continue the same approach. I think those were our biggest challenges, right? To say, are we going to stay the course on how we want to do this? And Dr. Moss and the executive cabinet never wavered in that commitment. We paused briefly. We reflected on what sort of that transition to COVID taught us, and then we restarted. And I think we came out with actually a better product than we would have had originally.
Wow, from adversity and challenge, you learned. So talk to us a little bit about what are some of the biggest learnings you had throughout the process? What are the ahas and what are the things you go, what this really we picked up on this and it was a great learning.
I think, the broad-based learning that, we always understand through improvement is how committed our associates are to making things better. In this case, to developing a really robust and visionary plan. And so you're asking for people to do extra, right, by committing time and their resource to doing some of this work. And people just continued to want to contribute. And I think that learning of just when you're doing something that really is inclusive and thoughtful, that people do want to contribute. It was a really great and inspiring learning, I think. And I think the transparency was the other part that was a learning, and I was just really proud of. We've had a very robust daily management system in place. We surface problems routinely, but you always struggle with, are we being as direct as we can be, as transparent as we can be? And people came and just, put it all out on the table. And so that learning was encouraging, that we weren't afraid to talk about our problems, and try to figure out, the best way ahead with a new plan.
So kind of follow up on that, I would imagine. So can you talk a little bit about some of maybe the secondary ways that culture and that philosophy spread to other areas that you might have experienced, that those benefits kind of transcended beyond the original management system and the original strategy deployment? How did that help elsewhere? Do you have any examples?
Yeah, I think, the best example I can share with you is the way that we structured the ownership of the strategic plan. And so we've got a clinical and an administrative owner of each thing. When I think of our management system, one of the deficiencies has been clinician engagement, right? I mean, we certainly have some, and it's great in some places, but we could do better, right? Is it as broad-based as we would like? No way. And this has really brought the organization, I think, the clinical and administrative functions much more together, really, right? We've got a singular vision, a singular strategy, and a singular management system to make it happen. And I do think it's just given us much better alignment and co-ownership than we've had before.
Oh, fantastic. So Kellie, any final thoughts you'd like to share with our listeners?
I think it really is just about patience. We've been at this a long time, and to see all of these pieces finally come together is really exciting, but it has been an exercise in patience.
Both patients, the ones you serve, as well as having patience as you go through the process.
Indeed.
Kellie, thank you so much for joining us today.
Thank you for having me.
And I'd like to thank you all for listening. Visit createvalue.org/the lens under peer-to-peer learning to find more information about the Catalysis Healthcare Value Network and other ways you can get involved in the Catalysis learning community. Stay tuned for more episodes designed to help healthcare leaders support their organizations on a journey to organizational excellence.
Thank you for listening. Visit createvalue.org/the lens to learn more about how Catalysis can inspire you to accelerate change in your organization.